All right, today we're stepping inside the operating room. It's a world of incredible pressure and precision, where there's often no undo button. We're going to focus on one single deliberate action, the surgeon's pause. It's a moment that, truly, can be the difference between a routine success and a life-changing mistake.
Just picture it for a second. The surgeon, under those bright lights, completely focused on a screen showing the inside of a patient. The pressure is just immense. Every single movement has to be perfect, because in that world, one wrong cut, well, it can change absolutely everything.
So that brings us to the big question. During a laparoscopic cholecystectomy, which is just the medical term for removing the gallbladder, a surgeon gets to a point of no return. They're about to clip and cut what they're pretty sure are the right structures. In that one moment, what's the most important thing they can possibly do?
And the answer, it's so simple, but man, is it powerful. Pause. That's it. Just pause. This one word, this one deliberate action, is the bedrock of a safety philosophy that has literally saved countless lives. It's the mantra for everything that comes next.
Now, we're not just talking about taking a quick deep breath here. This pause is a structured, mandatory stop. Think of it like a pilot's pre-flight checklist before a surgeon. It's a protocol designed to verify the anatomy before they do something they can't take back.
And here it is, the whole shebang, the 5-point safety checklist. This is really the heart of what we're talking about today. We're going to go through each of these, one by one, to really understand not just what they are, but why they are so absolutely crucial for keeping patients safe.
Okay, first up, you have to know the lay of the land, right? These first few checks are all about navigating the patient's unique anatomy. They're like the surgeon's own personal GPS for the operation.
So, step one is all about finding a specific landmark, Rouvier's sulcus. The best way to think about this groove on the liver is like a do not cross line. By making sure they always see it and stay below it, the surgeon creates a safety boundary. It keeps them from going too high and accidentally damaging the main bile duct, which would be a total disaster. Checkpoint number 2 is all about getting a crystal clear view, no ambiguity. This means cleaning away all the fatty tissue in the area, what's known as the triangle of Calotte, and getting that gallbladder totally separated from the liver. There can be absolutely no room for guesswork about what you're looking at. And now, we get to what might be the most vital rule of them all. The magic number you have to remember is 2. Not 1, not 3, just 2. So why is that number so important? Well, before any clipping or cutting, a surgeon has to see 2, and only 2, structures going into the gallbladder. That's the cystic duct and the cystic artery. If you see 3 structures, or you're just not 100% sure, that is a massive red flag. Alarm bells should be ringing, you stop, period. Which leads us straight to point 4, remembering that every single patient is different. You know, our bodies aren't all built from the same exact blueprint. A surgeon has to be on the lookout for weird anatomical variations, things like a Moynihan's hump, where an artery takes a strange path, or ducts that are super short. These are little anatomical tricks that can easily fool a surgeon into cutting the wrong thing.
So, what happens when you've done all these checks, and you're still not sure? The anatomy just doesn't make sense. Well, that brings us to the final, and maybe the most courageous point on the entire checklist. This is the ultimate safety net.
If in doubt, bail out. Let me be really clear about this. This is not failing. This is the absolute peak of professionalism. It means a surgeon has the wisdom to recognize when it's just not safe to proceed. It might mean switching to a traditional open surgery or just stopping the procedure altogether to rethink things. It takes real courage, but it is always, always the right decision.
So as we start to pull this all together, you can see this is so much more than just a list of steps to memorize, right? It's a complete philosophy. It's a mindset that puts the patient's well-being above everything else.
Look, being efficient in surgery is great, but it can never, ever be more important than being safe. The goal isn't to be the fastest surgeon in the hospital, it's to be the safest. And this checklist helps ensure that careful, methodical approach every single time.
I heard this metaphor, and it hits the nail on the head. A surgeon's knowledge of anatomy, that's their compass. It points them in the right direction. But humility, the ability to admit you're not sure, to respect that things can be different, and to know when to stop, that's the map. That's what actually gets them through the dangerous territory safely.
And that really leaves us with this final, powerful idea.
It's a lesson not just for surgeons, but for anyone in a high-stakes job. Master your craft, absolutely, but always respect the variables and have the humility to prioritize safety above all else. It just goes to show that sometimes, when everything is on the line, the smartest move isn't to push forward. It's having the wisdom to just pause.